टेलीविजन पर।
Hello and a very warm welcome to the brand new edition of Policy Watch with your host, Kriti Mishra. NITI Aayog has released a white paper, Vision 2035 Public Health Surveillance in India, to make India's public health surveillance system more responsive and predictive to enhance preparedness for action at all levels. Citizen-friendly public health surveillance systems will ensure individual privacy and confidentiality enabled with a client feedback mechanism. Improve data sharing mechanism between centre and states for better disease detection, prevention and control. India aims to provide regional and global leadership in managing events that constitute a public health emergency of international concern. The white paper lays out India's vision for public health surveillance through the integration of the three-tiered public health system into Ayushman Bharat. And for deeper insights on the topic, I'm joined by Dr. S.K. Singh, Director, NCDC, Ministry of Health and Family Welfare, and Dr. K. Madan Gopal, Senior Consultant, Health at the NITI Aayog. Welcome to Rajya Sabha Television, both of you. Dr. Gopal, coming to you first. The Vision 2035 Public Health Surveillance in India envisions a public health system which will involve stakeholders at all levels, be it individual, community, healthcare facilities, or even labs. Take us through the important highlights of the white paper on the vision.
Thank you, Kriti. It's very interesting because this white paper is a continuation of the reform agenda which NITI is pursuing. Last year, we have set agenda for the health sector reforms. In 2019, and this is the continuation of work. If you look at the surveillance activity, what prompted us, because the COVID epidemic has provided us an opportunity, because they are emerging diseases and they are re-emerging diseases, as well as there is an increased interaction of the human beings, environment and the animals. The Wuhan epidemic, it has a classic example of the interaction between the animals and the human beings. In India, we have a surveillance system where the health surveillance is happening, and we are making attempts at how the environmental surveillance and the zoonotic surveillance, they all are working in silos, how to integrate them on one platform. That's a challenge, and the vision documents talk about that. It talks about 4 building blocks. You have already mentioned about the gist what this vision document talks about, but it articulates the vision and highlights the importance of having a federated architecture, because the surveillance can't happen in isolation. The center alone can't do it. It has to be an interdependent system between the center and the state. As well as, if you look at the challenges which we posed, quickly we were able to rise to the occasion. During the epidemic, we were struggling with the diagnostic labs. The diagnostic facilities were also ramped up very fastly. As a result, what has happened, we are able to cope up that. But nevertheless, we have to prepare for the adversities in the coming years. Because if you see, the United Nations has declared this pandemic as a national threat to any nation. Apart from that, the European Commission, they have highlighted the need to have a response system, but way back in 2016, but not much work has happened on that. But this is the right time to at least galvanize all our efforts and strengthen the existing system to take forward that thing. This vision document has come, and it has explicitly talked about the building blocks and where we stand, and ultimate objective of this, we should have a CDC kind of organization in the country which can drive all the public health response. We have made attempts earlier in the form of epidemiological intelligence system, but a lot more work is to be done. Over to you, please.
Well, absolutely, sir. We need to galvanize all our efforts during the pandemic and even beyond. Dr. Singh, as Dr. Gopal was pointing out, that India rapidly ramped up its diagnostic capabilities and aligned its digital technology expertise. Now, this has ensured that there was a comprehensive tracking of the pandemic. The COVID-19 pandemic has provided us with an opportunity to revisit emerging diseases due to increased interaction between human, animal, and environment. Now, early identification of this interface is essential to break the chain of the transmissions. So how do we create a very resilient surveillance system?
So I think you have very rightly pointed out that the surveillance data from various sectors need to be put under one roof, and all the data should be talking to each other. And under that concept only, the new integrated health information portal was conceived, and it was launched also in 9 states before the COVID pandemic happened. And really, to be very true, that all states were not at all prepared in that regard. And I put it very bluntly, no country in the world was prepared for this kind of pandemic, and neither they had resources nor they had the vision. So, having said that, we have realized that in COVID pandemic, at least public health surveillance system is the system which definitely handles it more appropriately, as has been shown in India. Because in the Western world or in the developed countries, which are far, far ahead in the clinical management, good hospitals, good healthcare facilities, and very highly qualified clinicians, they were not able to manage the pandemic in the way in which the India has managed the pandemic. And we are definitely having less mortality, less morbidity, and as of now, the highest level of recovery rate also. So I think this particular success of public health surveillance coming together with the political commitment and whole of government approach, I think this has shown us the way that how the public health system together with the government and the planning process coming together, then we can definitely go ahead with the early detecting the early warning signs. I think I will just like to mention one more point, that is the surveillance in the human sector depends not only among the diseases which happen in human, but also among the factors which are lying outside the human sector, which are in the environment, which are in the zoonotic pathogens, or which are in the agriculture sector, or which may be in the poultry or pharma industry like antimicrobial resistance. So I think we need to have a robust surveillance system which picks up early warning signs in various sectors. And then all these signs are epidemiologically intelligence is used to analyze them and to predict or to have an idea that what can happen in future. So early warning signs will definitely give us an early indication and give us time for having adequate preparedness.
Well, absolutely, sir. Robust surveillance system is of paramount importance. It is an essential action for disease detection, prevention, and control. But Dr. Gopal, what are the goals of public health surveillance envisioned in the white paper? And specifically, how do you view the progress made so far for public health surveillance in India?
I will just reiterate what has been stated in the vision document, how we want to see the public health in 2035. So we want to see a health system which will be predictive, which is responsive, which is integrated and a tiered system. That means all the levels, that is district, state and the national level. Disease and the health system that is inclusive of prioritize emerging and re-emerging communicable and non-communicable disease and conditions. We are including the non-communicable disease also because right now the whole focus has been on the communicable disease with little monitoring on the non-communicable aspects. As Dr. Singh has rightly pointed out that we have to expand that there are other determinants which influence the health of the human beings. So we are trying to have a system which is predictive, which is responsive and which can be integrated and the early warning signs can be thrown from that. And what we are envisaging in this document, we had to have a de-identified individual level data. The National Digital Health Mission is now attempting at a personal health record. The challenge which has been thrown in our country is that if we had that individual level records, we could have at least analyzed the effect of BCG and the outcome, whether the people who are having BCG or MMR vaccination, what is the status of COVID infection in these people? The people who are having comorbid conditions, if we had the data, what is the status, what is the outcome in this? We are taking the data when they are admitting, we are taking the data. But had he had this data, then it could have been this. So this talks about the individual level data, which can at least give alerts and other things for managing the responses better. And we are trying to see that it is gone by adequately trained and resource effective staff. The major crunch despite the lower staff, I will compliment the NCDC that despite the crunch in the HR, they have been able to do the contact tracing and the epidemic response management very effectively. We are still following the 18th century norms for managing a epidemic. That means tracing the contact, isolating and vaccinating. Vaccination is still not there, but we have to go away and increase use of the electronic and the digital thing and the technology for surveillance. We try to attempt that thing. China has done it effectively, the use of technology for contact tracing and putting the people in containment based on the other thing. We have tried to do it significantly with the help of Arogya Siddhi, but how much it has been successful, that will depend on how we have been able to implement that thing. That's one thing. But we are in that direction of implementing the use of technology for the surveillance and the contact tracing when the epidemic occurs. Before the epidemic occurs, the electronic health record, the individual level data would be there for monitoring the trends in the disease. Then apart from that, one of the major commitment as the UN General Assembly, they have labeled that any pandemic is a national security threat. So we are trying to see that how we can have data sharing mechanism with the other countries and can establish ourselves as global leader in doing this. In this pandemic, we have been helping. We have risen to the occasion and we have helped many of the countries with the pharmaceutical supplies and the other thing. In this pandemic also, for forecasting other thing, we are envisaging that we would be global leaders in that as well. These are the things which we have envisaged in this vision documents.
So you're making a very important point there about technology, about data. I'd like to understand, how will public health surveillance broaden data access for all the relevant stakeholders?
You're asking me?
Yes, sir. Please, sir, go ahead.
You look at if you look at the 2009-10 that the H1N1 influenza, at that time the data was only limited to government agencies. Now you find about COVID, everybody is having COVID information. The government data and the crowdsourced data, more or less, they are similar. Previously, the data, because this has thrown a very good interesting, you talk about anything, any parameters, the data is available in the public domain, whether it is crowdsourced data or the data from the other universities, that data is available. And data matches with the data which has been projected by the ministry. That means that data sharing, more or less, there are other protocols, the data sharing protocols are being discussed and debated, and slowly the government would be coming up with the data sharing protocols. But nevertheless, whatever data which is being thrown by the crowdsourced initiatives and the ministry data, they are more or less same. That's one thing. This time, it has given an opportunity. If the data is available in public domain, the researchers can at least bring insights. Because if somebody is so much overwhelmed with the epidemic management, the epidemic response, there's less time left for doing thinking and bringing out new insights. So what is happening? The data which is available, people are bringing inside, they are throwing the intelligence out of this data and helping the people who are actively involved in the epidemic management for better responses. That thing is happening. Every other time we are, even from the data which is published in the ministry side, people are using that data and bringing in more intelligence information. When this vision is translated into reality in the coming days and we are moving in that direction, what will happen is that this data would be available and people will play around this data and they can bring insights and it can influence the policy and the epidemic response. That kind of thing, we are progressing in that direction. And there are many other initiatives which are there, they are doing it, and we are also moving in that direction slowly and slowly. Once a policy, data sharing policy is being approved by the government, and more data would be available in the public domain for researchers to use, to comment on that, and they can analyze the data, they can influence the people, and they can at least say that, okay, this is right, this is not right.
Well, absolutely, sir. So data protection bill is being scrutinized by a parliamentary committee. The government has already brought in a bill. Moving on now, Dr. Singh, India has made a substantial progress in the prevention, control and elimination of major communicable diseases. Smallpox was eradicated worldwide. Polio has been eliminated. Which diseases could India target for elimination by the year 2030? And what could be the pathway to elimination?
I think you are rightly forgotten two more diseases, that is guinea worm disease and jaws, which have also been eliminated to a substantial level. So both of these diseases surveillance is going on. But having said that, I think we have to understand the disease epidemiology in greater detail, because not only the disease which is amenable to eradication or amenable to elimination needs to be properly put in perspective, that whether it is a vector-borne diseases, if it's a vector-borne disease like we are targeting Kala-Azar, we are also targeting filariasis. We have also made our Honorable Prime Minister has made an ambitious goal regarding elimination of tuberculosis also, human tuberculosis I mean to say, maybe not bovine. So these are some of the potential diseases which can be targeted by the country. But I think I would like to add what Madanji has already elaborated, that having ambitious target is one part, but having adequate preparedness in terms of both use of this IT sector, use of political commitment, use of having a properly defined policy, committed and trained HR at all levels is the prime responsibility. At least if we have the adequately trained manpower, particularly in epidemiology. Now we have seen that even the whole of the administrative machinery has been trained in due course of in a course of 7 to 8 months. And even everybody knows that what is quarantine, what is isolation. These terms have become a common household terms now. So I think with this type of scenario, we need to move forward and address the challenges which are there in our existing surveillance network. Like we have program-based surveillance, we have outbreak-based surveillance, we have lab surveillance, we have animal sector surveillance, we also have some kind of environmental surveillance also. But these surveillance data are working in silos. Program and outbreak are different. Then the human and animal surveillance are different. Wildlife surveillance is another part. So all these surveillance networks are required to be brought in under one roof. And yes, use of IT is definitely the key. But I must underline that all the countries in the world are using the same tactics: contact tracing, cluster containment, providing perimeter control, having effective quarantine of the possible contacts which emerge as suspect, because you can't do away with suspect and quarantine of the suspect and treating the isolated. The earlier you isolate the infected persons, the better will be your transmission potential is cut down. So I think these will remain the key, whatever may be the pandemic, whatever may be the potential threat. But unless and until you target the spread of the pandemic, then only you will be able to break the chain of transmission, and you will bring the pandemic under control. Treatment and management are one part that is definitely required to be done in its lane. But yes, public health has its own role, and in each level, like in the beginning, we were having airport screening, were coupled with the community contact tracing, and thereafter we moved forward with cluster containment. But the disease which we are dealing is beyond these public health measures. It has spread from one district or entered the country, and now it is in all over the country. So now our target of surveillance is entirely different. We are monitoring active cases, we are monitoring the day-to-day growth rate, we are monitoring that how positivity and the testing is working together, and how the graph of the pandemic is coming down gradually. So I think all these factors give us a direction that yes, in which direction our control measures are working or not working, what needs to be modified, and these are all factors which need to be carefully put together. So have a properly epidemiologically analyzed data which gives us a direction, and on that direction only our policy should be based.
Well, right, sir, you're making a very important point there, and let me take that to Dr. Gopal. Dr. Gopal, the vision talks about the use of mobile and digital platforms and point of care devices and diagnostics for amalgamation of data capture. Dr. Singh was talking about skill development. How will India create a skilled and strong health workforce dedicated to surveillance activities?
It's a it's a very ongoing debate and a very interesting question, because if it, as Dr. Singh has mentioned, it took 7-8 months to at least make people understand what this quarantine is, what isolation is, what this perimeter containment, what containment is there, despite having a operational manual about that. It took it's a very mammoth task of skilling and reskilling the people about the epidemic responses and other things. Even the doctors who are trained, they need to be oriented about the epidemic. This is a very, very specialized kind of thing which needs some understanding and some skill-based learning. Because understanding data is very different. If somebody gives some data, an epidemiologist will understand the data differently than a common data scientist. If you give the epidemic data to anybody, they will just, you might have seen that kind of projection which has caused a lot of mishaps in the public thing. Because if the epidemiological function is very, very different, as has been rightly pointed out, and the skilling of manpower is very different. If you look at the IDSP program, which was launched to have this thing, it took many years to build a district level team. That too, the district level team, it's very difficult to say that how many epidemiologists are there who have been trained to do an epidemiological insights and give insights to the district team. That aspect is still missing. But in these COVID times, what has happened is increasingly the use of online methods have been used. The digital platforms have been used for training the people, as well as some of the innovations have happened in the digital field for contact tracing. But these have all happened in isolation, and how far they have been effective, that's only after once we are once we are done with the epidemic, then we can say that which of the tools have been effective. But nevertheless, efforts have been made to sorry to see
Right,
that
sir.
how.
Dr. Singh, I'd like to come to you, sir. Ultimately, the purpose is to serve the public good, the larger public good. How do we reduce the out-of-pocket expenses of individuals and families at the bottom of the pyramid?
No, I think you have raised a very valid point, and if we link it with public health surveillance, I think our job will be much more easier. Because yes, the treatment part comes when the person comes to the hospital. But I would like to underline that many of the diseases with which we are dealing, as Dr. Madan has already mentioned, that we have tried to bring even the non-communicable diseases under our parameter. If all these diseases, non-communicable, communicable diseases, and the diseases which can cause a potential public health threat, like Zika, like Ebola, like what we have faced in Nipah virus, AES, which we are facing in Muzaffarpur, all these, if you must have seen that our public health efforts in AES, which was a big problem in the year 2018, 19, and now this year we haven't seen that kind of mortality in the Muzaffarpur area and even in the adjoining areas of Bihar. So that is the type of approach which we require, that if we are well prepared, if our public is educated regarding the harms of the particular pandemic, then definitely we can tackle these diseases at an early stage. And if we tackle them at an early stage, then definitely our hospitalization will reduce. Like we have seen that the side benefit of COVID, we are following non-pharmaceutical interventions, and our Honorable Prime Minister is stressing it again and again. So by this, we have reduced even the incidence of tuberculosis, even the reduced incidence of H1N1. So these non-pharmaceutical interventions, which are helping us in a big way, particularly tackle the morbidity and mortality due to H1N1 and other respiratory diseases, is definitely, we can see that the interventions, if provided at the right time, will give us the benefit, and which in turn will reduce out-of-pocket expenditure, not only at the level of the well-off people, but also at the grassroots level, or the people who are really in much need of the reduction in this particular expenditure.
Well, absolutely, sir. And Dr. Gopal, before we end this conversation, closing comments to you on reducing the out-of-pocket expenses of individuals.
The survey which was happened earlier regarding the out-of-pocket expenses, the three aspects were identified. One was the diagnostic services. The second was on the medicines. The government, they have been trying to see that how this are being addressed to providing diagnostic services at an affordable cost, and the free medicines through the generic medicine, the Jan Aushadhi thing, these are there. But all these interventions will take time. And if you look at the information which is been coming, the national health accounts, it says that the out-of-pocket expenses have come down. At least for 3 to 4 points, it has come down. But we have to wait for the figures, final figures to come. But nevertheless, the government is making efforts to see that the catastrophe due to this out-of-pocket expenses are reduced because the major chunk goes to the diagnostics and the drugs. So the government is trying to make an effort that how to reduce the cost by having an affordable diagnostic services and pushing for the generic medicines. These are the two interventions which are already happening. And
Right, sir.
another thing which is the wellness aspect. If we are pushing for the wellness of this, we are always talked about the health. Now we are included the health and wellness component. If we are talking about the wellness thing, I think that will make dent into the out-of-pocket expenses as well.
Well,
Yes.
absolutely, sir. So India's public health surveillance will be predictive, responsive, and integrated. On that note, thank you so much for joining us. So that's all we have for you in this edition of Policy Watch. Thanks for watching and stay tuned to Rajya Sabha TV.